Thank you very much. I'm here this afternoon with Dr. David Allison, who is the Medical Officer of Health from Eastern Health. And we're here today to provide you with an update on this year's influenza season, our progress in securing additional vaccine, and the groups that we are targeting to have access to the vaccine. So in total, we have secured more than 80,000 additional doses of vaccine to further complement the 130,000 doses offered through our annual public program, which targeted, as you would know, children, pregnant women, people with chronic diseases, and seniors, and of course, healthcare workers. We feel that through our public program, coupled with vaccines offered through employers and private clinics, good coverage has been provided to our province's most vulnerable populations. The additional vaccines will provide further protection from the flu. Over the weekend, we received a shipment of 16,000 vaccines called Flu Mist, which is widely used throughout North America and Europe to protect against seasonal influenza. That vaccine supply is now being distributed to our regional health authorities, who, over the course of the day, will be issuing advisories outlining clinic schedules and other details in their area. As I indicated last week, with additional supply being secured, we targeted children under 5 and pregnant women. We will continue to offer vaccines to these groups. With a further 16,000 vaccines on the ground, we are now expanding our target groups to include generally healthy individuals between the ages of 2 to 59. We are targeting this wider group as this year's dominant influenza strain, H1N1, tends to have a greater impact on healthy adults, so we want to ensure that we are offering coverage to this demographic. Individuals with existing health conditions should contact the Provincial Health Line at 1-800-709-2929 to confirm whether they qualify to receive Flu Mist. This product, as I said earlier, is being widely used throughout North America and Europe. Flu Mist is an effective vaccine that is delivered through a nasal spray as opposed to a needle. As this product is being used in this province for the first time, we have ensured that our public health nurses have been fully trained to deliver this product. Before the week's end, we expect additional vaccine to arrive. At that time, we will again expand the target groups. As was stated last week, the new supply of vaccine will be in 2 forms now, a combination of injectable and nasal spray. Some of the injectable is approved specifically for use in individuals over 65. So where do we stand now? We feel that we have provided significant vaccine coverage for a wide range of our population to date, including the chronically ill, children, seniors, pregnant women, and healthcare workers. Within the next 2 weeks, we will have obtained enough vaccine to provide coverage to more than 40% of the population, and if the interest in receiving the vaccine continues, we will have among the top vaccination rates in the country. Please check with your regional health authorities' websites for the latest information on vaccination clinics. Individuals looking for information on target groups or clinic times can also contact the Provincial Health Line. And again, that number is 1-888-709-2929. We will continue to identify the most appropriate options for delivery in the coming days as we work through this targeted process. Our latest numbers, because I'm certain you'll be looking for the latest numbers, as of this morning, there were 182 laboratory-confirmed cases of influenza in the province, 40 hospitalizations, but again, we should point out that that does not indicate that all 40 are still in hospital. We had 13 admissions to intensive care. Only 3 are now in intensive care. And we're reporting a second death of a person in their 40s who had significant underlying medical conditions. In comparison, at the same time last year, there were 408 laboratory-confirmed cases of influenza, 138 hospitalizations, 16 admissions to intensive care, and 9 deaths. So our overall message is the same as it's been for some time. The province continues to see a moderate influenza season. However, people must continue to be mindful and remember the basic rules to reducing exposure or transmission of the influenza virus. People should remember to clean their hands regularly, cover coughs or sneezes, and contain their illness by staying home when they are sick. So as I conclude, I would certainly like to thank you again for coming today, as the media plays such an important role in creating awareness of the value of receiving the flu shot.